Happy to introduce the single-arm phase 2 study called the RENOBATE. This study is a multi-center phase 2 trial of the Regorafenib plus Nivolumab as first-line therapy for unresectable hepatocellular carcinoma. Regorafenib and Nivolumab is well-known the approved agent for the management of the unresectable hepatocellular carcinoma based on the phase 3 and the phase 2 studies, respectively. And there was evidence that suggests that the regorafenib may have the immunomodulatory effect, which enhance the antitumor activity of nivolumab in patients with unresectable HCC. That's the rationale of this phase 2 study. And the primary endpoint of this study is objective response rate per RECIST version 1.1, and secondary endpoint was PFS per RECIST version 1.1, and overall survival and overall response rate per the modified RECIST and the safety profile. A total of the 42 patients were included, enrolled in from the Korean from the three the institutions in Korea. And median age was 61, and the most patients, 91% of patients had the BCLCC stage. And in short, the overall response, the primary endpoint, the overall response rate per RECIST version 1.1 was 31.0%, which met the primary endpoint of this study. And the PFS per RECIST version 1.1 was median 5.5 months, and the median OS was not reached at the time of the analysis, but the 6 months OS rate was 90.4%. And there is no the unexpected adverse events of the regorafenib and the nivolumab. And so our results show that the regorafenib and nivolumab combination showed promising efficacy outcomes as first-line therapy in patients with unresectable HCC, and there was no unexpected safety signal, and most of the adverse events with this combination were well manageable, and further investigation of regorafenib and nivolumab combination in patients with unresectable HCC is needed. That's our conclusion.